My name is Melba D'Souza and I am a professor and researcher at the Nursing and Population Health, Thomson River University, British Columbia, Canada. I have been a researcher working on the Knowledge Translation and Cancer Care Network, working with the voices of people, the caregivers, healthcare providers, and healthcare service members in the community. My study and the involvement in the study has been looking at an intersectionality practice lens of understanding the process, the systems, and the experiences of people, and what is the ultimate journey of a person when he is or she is looking at cancer navigation and the supports they require. Going through the experience of this knowledge work that the people have in their own understandings in the journey in cancer, there's been an amalgamation of different experiences of people from different backgrounds and cultures, different languages, their cultural practices, their own experiences and perceptions of this journey, and insights along this cancer care journey when they are initially in the pre-screening stage and the diagnosis. And what does it take for a person who has been diagnosed with cancer? What are those early days and understanding of this treatment? What kind of treatment options are available and how to go through this process? Speaking to the Knowledge Translation in Cancer Care Network, it's important to realize the kind of prophylactic model that we can have for patient engagement in the care, and also to understand an appropriate cancer supportive model for people in the interior region in British Columbia, Canada. And the other aspects go into what is the holistic care approaches that people take and the caregivers and their families take on this journey of cancer from the time of pre-screening and diagnosis to treatment, and also during that initial years of recovery, coping, and having a survivorship during this journey. There are times when there are different informations available in the media and information from research, but what exactly are the approaches in the settings that the people live? Each individual experiences brings to the table different experiences and perspectives of the people. Drawing insights from this research study, we gauged a learning and understanding of the different experiences, the different perceptions, and also the different practices people have with cancer when they are being diagnosed, when they are treated, when they are surviving, and also what it means to them to have a good quality of life with their treatment. So whether it's an emotional and psychosocial quality and the strategies they need to take when it's about their own sexual journey, and also about the financial help and support they need, and also about the spirituality and the values and preferences they have in their own care and their journey, and what is the best approaches and best recommendations for a person to live a full life, to be able to be productive, and also to be having a better quality of life. When we talk about better quality of life, there are different perspectives that come to mind as what is this holistic life that the person is talking about, and how, when you look at a supportive cancer supportive care model, what does this cancer supportive model means to an individual? How can we tailor it to every individual who is experiencing cancer or who has finished the treatment in cancer, and where are the supports and resources in the community? Here, this research is founded in the British Columbia and the interior region, in different surrounding sites in rural areas of Kamloops, Revelstoke, Okanagan, and the different voices that people bring here are some of the studies that are talking about the surveys and about the focus group, and also interviews with people and their caregivers. So to sum up and say, this is an important aspect and very crucial to understand how knowledge translation plays a role in Cancer Care Network, and also to understand the different perspectives from people's voices and how to integrate this to have an integrated cancer supportive care model in the region. So welcome, Anne McCarthy, and thank you very much for being with us here in the Knowledge Translation Cancer Care Network. And today we just want to have a little conversations about your experiences with the cancer. So can you introduce yourself to us, like who you are and what was your role here in the research study?
Okay, so my name is Anne McCarthy. I am an almost 20-year survivor of breast cancer. My first diagnosis was about 20 years ago. My most recent diagnosis was 5 years ago with a diagnosis of metastatic breast cancer, incurable. So I am living right now with breast cancer and currently undergoing treatment.
And how would you say this cancer diagnosis and the treatment has affected your life?
Oh, it's changed it completely. Maybe the first diagnosis, I tried to carry on and pretend that I just had a normal life. And I went to work all through my treatment. I had my own business. I went to work. I looked after my kids. I just tried to carry on and do my regular normal life pre-diagnosis. Since the metastatic diagnosis, I've realized that I have to do things differently. I have to take care of myself more. I have to take care of my life in general more. As a survivor, your whole world just changes. Cancer changes your medical situation, your family situation, your financial situation. So you just have to adapt to that and accept it, which now I think I have. My first diagnosis, I don't think I did. I was in denial for 10 years.
So after your second diagnosis of the cancer and treatment, how did it impact your own recovery and surviving through that cancer care journey?
Well, even after my first diagnosis, I got excellent medical treatment. And I did after my second diagnosis. What I got after my second diagnosis was a realization that it's not just my medical situation that needs to be addressed. The medical treatment I was receiving was helping me to stay alive, but it was my quality of life that needed to be addressed. And that included things like mental health counseling, movement, exercise, meditation, yoga, finding resources, financial resources to help address the financial impact of cancer, which is huge and is not often addressed in the literature. Legal aspects had to be addressed. Things like power of attorney and maid is another whole situation that needs to be addressed head on with your family and caregivers. So quality of life issues became more evident that those kind of supportive services around quality of life for survivors was lacking in our community. The medical treatment is second to none. If you get cancer in this city, then you may have to travel out to town, of course, for treatment, but treatment is second to none. I'm testament to that because I was told 5 years ago that I only had 6 months to live, and I'm still here. So that's medical treatment. But it's the quality of life issues that make you want to live. And as more and more cancer patients are surviving, with the advances in treatment and research, more and more of us are surviving, then quality of life becomes an issue not just for us as patients, but for our caregivers, our families and friends, and for the medical system as a whole. The less of a burden that we are on the medical system, the better it can treat cancer patients as a whole. So I've come to the realization that supportive care and quality of life issues are just as important as keeping a cancer patient alive with the medical treatment. And it's changed my life completely because now I recognize that for my life and for other people in my life too.
So what would you say, I hear that you have said again and again in your voice about quality of life for a person who have had cancer and on the cancer journey and surviving. So what would you say would be important experiences for people to have that better quality of life once they have completed their treatment or on their treatment in cancer care?
Well, things like the side effects of treatment, like chemotherapy, for instance. Fatigue is a huge issue. Brain fog is a huge issue. Chemo brain. mobility and movement issues. If you've had surgery that's impacted your ability to move easily or to walk long distances, there are resources that can help you to deal with these. Yoga, meditation, massage therapy, physiotherapy, all of that is available for you in Kamloops, but most of it is fee-for-service. So what the medical system does not provide at this point for cancer patients is integrated supportive care like that to help with fatigue and brain fog and movement and mobility issues. And the more serious things that come out of cancer treatment too, like heart issues, lungs, COPD. So some resources are available in Kamloops at Royal Inland Hospital. But one of the biggest issues, the biggest gaps in services is the navigation network to help patients to find those services. And one of the things I found downright exhausting during my first go round with cancer was being my own navigator. And realizing that different doctors and different systems did not keep one set of records in one place for me. Every doctor had their own record-keeping systems. BC Cancer Agency has a different record-keeping system than Interior Health. And so you start over and over again with every person that you call. You have to tell your story, you have to fill out forms. And if all that were kept in one place, it would just make it so much easier for a cancer patient, especially one who's, as I did, I had 11 surgeries after my first diagnosis. I was mostly on drugs or unconscious or recovering from anesthesia. And it's really difficult to wrap your brain around internet research, talking to people, just going out in public and tracking down resources. So a navigation system or a navigation process, I think, would be key and core to cancer patients knowing, first of all, how to find these services and then to be guided through that process, because the patient often ends up as their own guide, and it's a dual role that is it can beat you down. Yeah.
Thank you very much, Anne. Is there anything you would like to say about this promotion of these cancer navigation and support services in the community?
I think it's wonderful. I think what I would like to see as a survivor and a current patient is more and more information in the community so that cancer patients can know immediately where to call. It's like everybody in our world right now knows that if you see a fire or an accident that you call 911. But there's going to be so many cancer survivors in Kamloops over the next 20 years that each one of us needs a kind of a 911 number to call. As soon as you get a cancer diagnosis, you call that number and then you'll be directed to the right resources, whether it's medical treatment or supportive care. But it has to be as easy as calling 911. That's my goal.
So it really looks like a roller coaster and a worthwhile journey that you've had and to be with us today. So thank you so much, Anne, for sharing those visual and making us go through that visualization of the experience you had. And I hope that we can continue to work with the knowledge translation and rightly, like you said, like a cancer care network in the community and in the region of British Columbia. Thank you very much, Anne.
Thanks for all your work too, Melba. We appreciate it. Thank you.
Welcome, Camilla, and thank you so much for coming and meeting us today in the research grant for this Knowledge Translation Cancer Care Network. So please, can you introduce yourself to us?
My name is Camilla Drake, and I was diagnosed with breast cancer in 2013, and so that's why I'm part of this research study.
Thank you, Camilla. And can you tell us or talk to us about the impact that the cancer diagnosis and the treatment had in your life?
Yes, the cancer diagnosis really impacted my life in every way, physically, mentally, emotionally, social, economic. Yes, life never went back to normal.
And how did you find yourself using the cancer care services and resources in your community and in the healthcare?
I'm very grateful for all the services and treatment I had. There was definitely lots of room for improvement, lots of gaps in the system. Yes.
Or would you like to tell us an example of some of your experiences during this time when you were diagnosed and treated with the cancer?
When you're first diagnosed, there's a lot of time where you're on your own and you're left to look at the internet, you're researching on your own. It would have been nice to get some sort of package, which didn't come until 6 months into my treatment. And by then I already knew the different kinds of cancers, treatment options, chemo, what the plan was. But to be diagnosed with cancer and then you're on your own, you don't even go to the cancer clinic. You go to see a surgeon after your GP tells you, and there was lots of room for improvement.
And would you like to tell us also, after your treatment, how has your life been with the cancer and the survivorship with cancer?
It's been a rocky road and ongoing tests and follow-up, and there was not a lot of options in Kamloops. You know, after radiation in Kelowna, coming back to Kamloops, I had severe burns and blistering, and they didn't know what to do. I mean, they taped my radiation burns. There's nothing in Kamloops.
Would you like to suggest what you would like to see in cancer care support and resources that we could have here in the community?
Oh, yes, definitely.
Would you like to give an example of any of them that you would like to have seen based on your own experience?
People need some place to check in, so they're not on their own and looking to the internet. They need a place to go, even if they don't get to the cancer clinic right away, where they can get the resources, get the information, ask their questions, get prepared. And then they need a place to continue follow-up, since most treatment is done out of town.
Thank you very much, Camilla, for being here, and I hope we will continue to be very resourceful as a community together in cancer care research.
Thank you.
Thank you, Camilla.
Thank you.
Welcome, Florian, to this session on Knowledge Translation and Cancer Care Network. And I would like to say that I'm so happy to have you in this research grant, that we work together. And something that adds to my attention is I'm Melba, working as a researcher in the research grant. And please, can you introduce yourself?
It's great working with you, Melba. We're a great team, and this is a really, really important topic to research, and it's close to my heart. So I thank you for having me on your team. Anything to do with cancer is a bit of a trigger as a nurse, but also myself personally, losing my mom to cancer. So the work that you're doing and the work that I'm involved with now with you is super important to make this an experience that is not only genuinely helpful, it's caring, it's supportive, and we know that the mortality rates improve if a person has those supports and goes through the experience in a way that, I know it's not a positive, exciting thing to be diagnosed with cancer, but at least to go through it in a smooth way and survive in the end with a positive outcome, and for the family too. So any of this research is important. And we live here in Kamloops in a rural setting, and we don't have a cancer clinic in Kamloops. And so people have to go to other places to get treatment, and that just makes it so much more challenging. So hearing these people's stories, interviewing these people, these participants have so much to share with us, and I hope that our video gets out there and that we're able to share the stories and give some insight to how people are receiving the knowledge, how they're dealing with it, how they're experiencing it, and hopefully we can make this whole system a better place, right? So one step at a time.
What was important from this research study about the experiences of the participants' voices and their perspectives about their own cancer, diagnosis, treatment, and surviving the cancer?
That's an awesome question, because our participants had about 5 main points that they made with us about their experiences with cancer. And I would say the first one, the biggest, the most important one, was just the process itself, being part of that process and being told what your diagnosis is, and then all these treatments, and being bombarded with all that information, and how overwhelmed and anxious that they felt just from that part alone, not even thinking ahead where to go with that initial kind of response of anxiousness. And that fear of like, what kind of tests what kind of experiences am I going to have with some of these tests, like chemotherapy? We hear all kinds of stories out there in the movies and from other people that you get quite sick from it, or radiation treatment or surgeries, right? What are those outcomes? So just a lot of shock, anxiety, overwhelmed feelings. So that's the biggest piece. And then ultimately that communication with that healthcare provider, if it's a doctor or a nurse practitioner, and being told about their diagnosis and the treatment options, and that ability of that healthcare professional on how they actually give the news, how they share the information, and then reciprocate the response. So, for example, some of our participants were feeling quite anxious and overwhelmed, but they also had some questions. They had some concerns, some fears. And were they being heard? Were they being listened to? Did they have a chance to vent out that initial response of being overwhelmed? And if they did get that response of support and being heard, that helped a lot. You have to imagine, we're here in a rural area. We interviewed participants that were all over the interior of BC, so very rural areas, some of them less than 90,000 people. They don't have a cancer center. We don't have one here in Kamloops. That whole piece about having to navigate through multiple people, multiple healthcare workers, oncologists, social workers, even maybe a travel agent, I don't know. A lot of people involved, and that whole trying to sort out that multiple healthcare piece, and also getting contradicting answers and stories. So we've got a lot of feelings of frustration being reported to us, and miscommunication. And so all of that, just an extra layer of hurdle of experience. And that, of course, would lead into the caregivers themselves, and maybe having a bit of burnout and a little bit of frustration. So all that spillover of being frustrated with not being heard, maybe, having to deal with multiple different people with different types of responsibilities, trying to help that person get through their cancer treatment, and then the services themselves maybe not being open when you need them to be open, physicians going on vacation, all of that. And then add in the financial part, the cost. You know, if I were downtown Vancouver, I could maybe go to all these places and make those phone calls and maybe have a nurse navigator. I don't know. But when you're traveling from somewhere else, it's going to cost me money to take off time from work, get a motel, hotel, deal with childcare, right? So these are the pieces that the participants reported to us. And the financial part, I think that you can't even total the amount of money it cost, and time itself. Extra time to get all of this stuff in motion. That costs money too. I don't know if you can put a price tag to it, but those would be the big things, I think. Can you tell us a story that illustrates how knowledge translation occurred for one of our participants, and how it kind of supports the Canada Support Care Action initiatives?
So in this research study, one of the participants' voice was that she was newly diagnosed with breast cancer, and she was very troubled and overwhelmed with the diagnosis, and there were several options given to her as treatment. So she didn't know where to go to, and she did some research on her own as to looking at information what's available, and what she did see on the internet was about the different natural remedies and also pharmaceutical drugs that are given for different kinds of cancer. So that made her more anxious and stressed with her own understanding of what would be best for her in this treatment decision making. And she also spoke about during that time she didn't really have an understanding too much into which option would be more safer for her, because she wanted to get back to work. She had a family and a caregiver. So she did try to connect with people who have had cancer, like the support group that was there in town. And she found it a little bit difficult in this journey of really understanding the information she needed when she was initially diagnosed and treated with the cancer. So from this research study, what we did gain from the several participants who had similar voices about understanding about the knowledge of the cancer, the information and resources they need. The knowledge translation is one aspect of where we bring together the researchers, participants, planners, decision makers, leaders, and healthcare providers who work with cancer care, and looking at the information that's out there and what's the best latest research evidence that we can give to the patient and the caregiver and their family so they could make the best decision they want for themselves. So that helps the participant to be empowered in their own decision making, and also to guide their own journey as to which option they would want, which is good for their own quality of life, and what are the other determinants that they have for them in their life to be able to, maybe they are a caregiver, maybe they are in their life working, or maybe they are someone who's going through another journey in their life with their family member.
Okay, so we just talked about the challenges.
Yes.
What about a successful story of someone who has gone through cancer from one of our participants in that field of cancer supportive care action initiatives?
So one of the participants who said that her name was Sam did mention that this journey of hers was very arduous, and she had a diagnosis which was in the advanced stage, and she was also new to the country and trying to understand and integrate into the society. So it was difficult and frustrating to her even about the language and understanding what this cancer would entail for her after the treatment. So she was trying to look for resources and also looking for connections in the community as a way to get resources, example like help with her childcare, help with a mom at home, and also with after the treatment how she could go back to work, and even the financial burden of some of the travels that she had to do to go for diagnostic, and even meals and stay and childcare. So she did express it was a hard journey, and during that time at the cancer clinic, they did connect her with the, they did mention to her about there's a cancer support group in the community, and she did approach the cancer support group, and from there she had a kind of an informal mentor who talked to her about what the cancer journey would be with breast cancer, and also what kind of treatments and what would be the survivorship. So she got connections from the community which helped her in her journey, and she did say that because of this it helped her also to become an advocate and even one of the fundraisers to help other people who are going through the cancer journey and able to envision that. So from this knowledge translation grant, what we can see is that participants who bring in their own experiences and have had a journey in their cancer have this support care system and the navigation that help them to get through the treatment and also survivorship. So working together with planners, leaders and decision making, and even with researchers who bring to light latest research and evidences and how to create a prophylactic model for cancer care and also for a patient engagement in care is a best voice to involve patients and what is their needs and preferences. Also at the same time sensitivity about their cultural aspects and also about their own language.
Melba, can you describe the challenges that exist in translating knowledge from research to practice in the context of cancer supportive care action initiatives?
So through this knowledge translation grant, one of the important crucial areas that came up was increasing communication, coordination, and also collaboration with healthcare service providers and also community healthcare service providers who provide different aspects of the treatment and also different alternative and complementary care treatments to people. So just understanding and getting that communication across to people with cancer and caregivers is one of the most important aspects. And the second aspect is about the time that takes researchers to communicate in a language that is understandable to healthcare services and also to community care services in terms of the latest research evidence and also what is the latest on supportive healthcare models, which requires again funding to support the voices of the participants and also funding for healthcare service providers to be engaging in a more open framework for patients and to be understanding their journey, which takes into account a culturally appropriate care and a linguistic appropriate care. And the last part of the bit is the most important one, is the participants. The participants and caregivers on this journey, and what is the best evidences and research need to be accumulated and even being available to them and shown to them as to where to gauge the sites as to what's genuine and how to be able to look at research to make their decisions when they are doing decision making, to empower their own selves to make the appropriate best decision they have at the time.